HIV stands for human, as it only affects humans, immunodeficiency, as it weakens your immune system by destroying important cells, virus, as it can only reproduce itself by taking over a cell in the body. HIV isn't like most viruses that your body can clear out. Your body is unable to get rid of it, so once you get HIV, you have it for life. HIV attacks cells in your body and uses those cells to make copies of itself until it can finally destroy the cell. The cells in your body that are responsible for fighting illness and disease are the main cells that get attacked by the HIV or AIDS virus, leaving your body unable to properly protect itself and making you more susceptible to infections for longer periods of time. The number of those cells decrease over time, which can lead to your development of AIDS. How do you get HIV? If you are injecting drugs and happen to share the needles with someone with HIV, you can easily contract the disease yourself. HIV is also spread through sexual intercourse. In rare cases, HIV or AIDS can be contracted from being born to a mother with HIV and being breastfed, or receiving blood transfusions with someone with the virus. Basically, any exchange of body fluids like blood, breast milk, semen, or vaginal and rectal fluids with someone who is HIV positive can result in HIV. The first stage of HIV begins 2 to 4 weeks after getting the infection. One will develop flu-like symptoms, which include swollen glands, sore throat, rash, muscle and joint pains, headaches, and fatigue. This is called the acute retroviral syndrome, or primary HIV infection. It is the body's first response to the illness. This stage is where the disease is taking over the cells in your body very rapidly. The next stage is called clinical latency stage. Latency means for the person to be living with the virus without producing all the symptoms. This stage is sometimes called chronic HIV infection. This virus is continuing to produce the cells, but very slowly, as to not produce these symptoms. Without treatment, this stage can last for up to 10 years. AIDS is the final stage of HIV where your immune system has become seriously damaged, and you are susceptible to various diseases and infections resulting in specific cancers. Without treatment, in the final stage of HIV, the life expectancy has fallen to 1 year, but with treatment, someone can live up to 3 years. AIDS stands for Acquired Immunodeficiency Syndrome, A being something you acquired, not inherited from birth, I being immuno, as the organs and the cells in your immune system are the ones that fight the illness, D as in deficiency, being the way your immune system is being deficient and not working properly, and S being syndrome, as in a collection of signs of a disease. With HIV, you will notice some changes to your body which could be caused by the treatment you take. One is body fat changes. You may see an increase of fat in the abdomen, neck, breasts, face, as well as little pockets of fat all over your body. These are called lipomas. A loss of fat can be experienced in your face, as well along with your legs, arms, and butt. HIV can result in illnesses or problems such as cervical cancer, tuberculosis, lymphoma, and even brain impairment, along with many others. There are many treatments and medications available nowadays to help those with HIV or AIDS, but this disease does not have a cure, or even one medication that can help. Someone living with this disease would have to take a number of different medications a day to be able to live their life as fully as they can. While the treatments have been known to be effective, there are always the risk of side effects that can include dizziness or fatigue, nausea or vomiting, and rashes. To reduce the risk of getting HIV, you should take precautions such as using condoms all the time and correctly, not sharing any drugs or needles with anyone, reducing the number of people you have sex with, and have them get tested before engaging in any sexual activities. Remain in contact with your doctor and continuously get tested for HIV and other STDs that can increase your chances of getting HIV.